Welcome to the Town Hall on Youth Sports, hosted by the San Francisco Department of Public Health and produced by the virtual outreach team of the COVID Command Center. Today's event is being recorded and streamed live on YouTube. We respect all participants in this convening today and want to create a safe space for all. By default, all participants will be muted and video is disabled. Video will be on for speakers only. To participate in the Q&A, please select the chat button at the bottom of your screen and send your questions to Q&A. Glynis starts. You can save lives and stop the spread of COVID-19 by getting tested through your healthcare provider. If you have symptoms or have been exposed to COVID-19 but don't have health insurance or can't get tested through your provider, visit sf.gov/gettestedsf or call 311 for information on getting tested at a city-run testing location. A safe and effective COVID-19 vaccine coupled with continuous preventative measures are our best tools to end the COVID-19 pandemic and safely reopen San Francisco. Go to sf.gov/COVID vaccine for information on eligibility, vaccination sites, including locations, and links to book an appointment if available. This is our agenda for the evening, and I now hand the meeting over to Katie Tang. Katie, the floor is yours.
All right, good evening, everyone. Welcome to the Youth Sports Town Hall. I'm Katie from Department of Public Health, and I'll be facilitating the webinar tonight. So I know all of us have been anxious to get back to all the activities we once engaged in pre-pandemic, and we certainly know the benefits of sports and exercise, engaging with peers, and spending time away from Zoom. So this evening, we will provide information and guidance about how to engage in youth sports safely in a COVID-19 world, measures that the city has taken to support youth wellness, and answer questions that you have. So we are fortunate to be joined tonight by DPH's Acting Health Officer, Dr. Susan Phillip, as well as Phil Ginsburg, General Manager of Recreation Parks, and Dana Ketchum, Director of Property Management, Permits, and Reservations. So we thank you for joining us tonight, and I'll now turn it over to Phil Ginsburg from Recreation and Parks.
Thank you, Katie. I'm here. Still thinking about this whole Trey Lance versus Mac Jones 49ers draft pick, for those of you who are also watching. I'm really happy to be here, and I want to welcome parents and volunteers, coaches, athletic department staff. Look, this year's been a very different ballgame, and I want to acknowledge your patience. I am both a parent and a coach, and I know firsthand how tough it's been. The San Francisco Recreation and Park Department, and frankly also the Department of Public Health and our mayor and just about everyone in our city, are strong believers in the physical and mental health benefits of youth sports. Obviously, sports build self-esteem, integrity, problem solving, and the importance of playing within the rules. Sports nurture talent, relieves stress, helps develop gross and fine motor skills. And because of the myriad benefits, and because kids waited so long, we wanted to make sure that they didn't wait a moment longer than necessary to get back in the game. Since we are the stewards of most of this, not all, but most of the city's athletic fields, we launched our spring mini season April 10th in partnership with local youth sports leagues. And we're thrilled. I was with a parent today who said, "Hey, thanks very much. My kid has played 9 games in 10 days. Kids are safely enjoying the sports they love. And obviously, they are very dependent on everyone following our health guidelines." This is kind of obvious, right? We want youth sports to be safe and fun. Tonight, we hope to provide some clarity as well as answer any questions you have. And I'm very pleased to be joined by my colleagues. Katie, thank you for moderating. Dr. Phillip, thank you so much. Anna, thank you very, very much for sharing your time and expertise. And I will turn it over to and of course, my colleague, I almost forgot her, who has worked harder during this pandemic than just about anyone I know to make sure that not just kids, but adults and everyone who uses our parks has safe and active spaces. Thank you in advance, Dana Ketchum, for being the incredible public servant you are. with that, I will turn it over to my colleagues and let's let the program commence.
All right, thank you. And I neglected to mention that Anna Lidzik, also from Department of Public Health, will be co-presenting with Dr. Phillip. Apologies, Anna. So with that, I'll turn it over to both Dr. Phillip and Anna.
Good evening, and thank you, Katie. Thank you to the entire Joint Information Center virtual outreach team for enabling us to have this conversation, which is so important. And thank you, GM Ginsburg, and your entire team, especially Dana, for everything you've done in partnership. Together, I think we've really been able to do as much as we have been, and we look forward to doing more to get kids back playing. Because as everyone has said here at the Department of Public Health, and I as the acting health officer fully believe that sports are essential for kids, and being active is part of healthy living from very young age. And for physical and mental, emotional, and social health, we want our kids to be playing and to do it safely, which has been tricky during this pandemic. So I want to thank my colleague Anna, who is going to co-present with me, but I will start with giving a few slides and a little bit of framing. And then I know that everyone is very eager to hear specifics of what we're doing now, but more importantly, what we might be doing in the future as we move into the yellow tier.
I'm sharing now. There we go.
Great, we'll go to the next slide, please. So I want to start with where we are now, which is very different than where we have been, thankfully. In January, we had the largest surge to date that we've had in San Francisco. It was our third surge, and it was the highest that we had had, but we've come down since then. And we've moved through the tiers from purple tier under the state's guidelines and blueprint to red, and then to orange. And now we're just on the verge of getting to yellow. And if all goes as expected, we believe we will qualify next week to move to the yellow tier, which is very exciting after the very, very long winter. And let's face it, long year and a half almost that we have all had dealing with this. And while we see that the cases are down, this does have to be in the context of looking not just locally in San Francisco and in California, where we're doing relatively well, but looking across the country and looking across the globe and seeing that in places as far away as India, we see really devastating impacts of unchecked cases, rising hospitalizations. And we can even look to our neighbors to the north in Oregon and in Washington, who also seem to have a good handle on COVID-19, but then suddenly we're seeing increases in cases and hospitalizations, are now unfortunately at the point in some areas of having to roll back the openings and the advances that they had already made. That is what we are trying to avoid in San Francisco, and that is why we have gone through a very deliberate pace of reopening, including with youth sports and adult sports and recreation. And we, again, appreciate your cooperation, your patience in what has been a very trying year. And we are going to try to move forward as we can safely to allow these really important activities to continue. Next slide, please. The key to doing this and being able to continue doing this is vaccination. And in San Francisco, we have done a good job as a city, and the residents and the people who work here have stepped up and gotten vaccine to protect themselves, their family, their community, our entire city. And it has made a world of difference. We are ahead of the state. We are ahead of the country in terms of the percent of our eligible population who has gotten at least one dose of vaccine and has completed their entire vaccine series. So as people know, a vaccine is available and is authorized for people who are 16 and older. So kids currently under 16 are not able to get vaccine. However, we understand that that may change and that Pfizer has applied to the Federal Food and Drug Administration to have children who are age 12 to 15 be eligible for vaccine. And we anticipate that that might be as early as mid-May. But for the San Franciscans who are currently eligible, 70% of them have gotten at least one dose of vaccine or been partially vaccinated, and 46% have been fully vaccinated. This is what is going to allow us to continue to reopen, to continue to have sports, to increase, to remove restrictions. And so I would encourage all of you, if you have not gotten vaccinated, please do that. And if you can encourage people that you might know who are considering it or haven't quite gotten around to it, please do that. That is probably the single biggest thing that we can all do to keep our city moving forward. There are plenty of appointments available now at all of our vaccine sites, and you can go to SFGov to find out more about how to get a vaccine appointment if you need one. Next slide, please. And the vaccine is incredibly important because we want as much as possible to drive down the overall rates of COVID in our community. And that is how higher contact activities such as some sports are going to be able to be done more safely. And unfortunately, we know from data throughout this pandemic and from reports from our colleagues all over the country that youth sports have been associated with outbreaks. And as recently as days ago, we've heard about Berkeley High School and students, athletes who have tested positive there. So it is a real concern, but we do think there are ways of mitigating that concern. And as case rates go down across the city, it becomes more safe to be able to engage in these really important physical activity and athletic endeavors. So with that, I'll turn it over to Anna for the next set of slides.
Thank you, Dr. Phillip. I am going to give an overview of the guidance related and directive as it relates to sports at this moment in time while we are in orange tier. And then we will talk a little bit about what we anticipate in the future. But recognizing this is a screenshot from the state's sports guidance, and they are the ones that have assigned all of these different sports related to different tiers. So you will see here, outdoor low contact sports are what is allowed in purple tier. Outdoor moderate contact sports is what is allowed in red tier. Outdoor high contact sports and indoor low contact sports are what is allowed in orange tier. And then all the way to the right is the indoor moderate and high contact sports, what is listed in the yellow tier. Just so everyone has a grounding of all of the different sports as it is assigned to the yellow tier. It is important to note San Francisco does not assign these sports. This is something that the state has done, and we are bound to follow the state guidance. So the current youth sports guidance and directive as it stands in San Francisco is that we do require masks at all times, except if it is a water sport or if it is a socially distanced competition, such as cross country or track and field. We know that masks are possibly one of the most important prevention methods for COVID-19, and we are requiring masks for youth sports in San Francisco to protect our young people and the staff from getting infected from COVID-19. We now allow youth to participate in 2 or more non-school activities at the same time, except those that are playing an indoor high contact sport. We will get into details later about how that could potentially change, but at this point in time, the only restriction to any activities out of school are for those athletes that are playing an indoor high contact sport. And for the team sizes, it is allowed to be up to 50 for any outdoor sports and 25 for indoor sports, recognizing that indoor environments tend to be riskier for COVID-19 than outdoor environments. However, if there is a team that needs to have more athletes, they are more than welcome to submit an application to the health department justifying why the team needs to be bigger and all of the prevention measures that will be put into place in order for, and then we will review that and approve it as necessary, as long as it is as safe as possible for the team. And right now there is testing requirements for all teams that are participating in moderate or high contact indoor sports as it is defined, as it is outlined in the state sports directive, and also for outdoor water polo. We have recognized that these sports have contributed to outbreaks in other areas of the country, and we want to make sure that it is safe as possible for all of the athletes and the staff in order to participate in these sports safely. We want to acknowledge that we are allowing competition for all of the sports that are permissible in San Francisco. At this point in time, only 2 teams can play against each other at the same time, except it is a low contact outdoor sport. Again, these are sports like cross country, track and field, tennis, golf, etc. All of those sports that were outlined in the purple tier. The state has now allowed that teams can compete all across California. Previously, it had to be counties that were neighboring to your local county, but that has been expanded. However, it is not permissible to compete in out-of-state competitions or any meets with teams from out of state coming to California. We are finding that this is contributing to a large number of the outbreaks related to youth sports is when there is travel out of state and the athletes are coming back to their schools and possibly bringing COVID-19 back to those schools. And we are now allowing spectators at all of these sports. We want to highlight, we have just published a new page on sports. The website is listed here, and we will be updating this on a frequent basis as we move forward in future tiers and make any changes. So please visit this website and bookmark it if you are interested, and you will see the latest and greatest on this website. Also recognizing that we are approaching summer camp and summer programming, and that would include a lot of the summer camps related to youth sports. We are offering that we are continuing the practice that we had last summer, that all summer camps and summer learning programs must operate between June 1st and August 31st. We are maintaining that sessions need to be at least 3 weeks long. And this is because that vaccines are still not eligible for those that are 15 and under. And until then, we really need to make sure that we are limiting the amount of transmission for our young people and our athletes during this time. This is very hopeful that this will be the last summer that we will have to do this, but we want to make sure that we are moving forward with reopening as safely as possible, as Dr. Phillip had referenced earlier. And with that, I am going to turn this over to Dr. Phillip, who can describe some of the changes that we anticipate in the yellow tier. Thank you.
Thank you very much, Anna. And I do want to talk about yellow tier. I anticipate that this will be a really exciting topic and hopefully some good news for the athletes, for families, coaches, and staff in schools. So in the yellow tier, and again, this is not going to be finalized until the orders are issued, and we anticipate that will be at the end of next week. But we will need to look at the final orders and wording in order to confirm that no changes had to be made between now and then. But we're right now anticipating that because we are doing relatively well, because we haven't seen increases in cases with the amount of activity that we've increased so far, we will be able to allow all sports for all ages. That screening testing that had been required for indoor sports will be reduced and in fact eliminated for some sports such as basketball and volleyball. That allowable team sizes will remain the same in yellow tier. That athletes in indoor high contact sports will be allowed now to participate in other OST programs. Masks will be still required for youth sports with very, very limited exceptions. As Anna said, masks are one of the key interventions that we have for prevention among youth who are too young to be vaccinated. Vaccinated athletes and staff will not be required to quarantine or participate in asymptomatic testing. The prohibition on traveling outside of state still exists, and we will be following up with compliance efforts if we understand and can confirm that that activity has been happening. Vaccinated athletes and staff must also continue to wear masks. I know many people have heard about the changes to the CDC guidance. Those were in very particular circumstances. They did not include activities that brought people into proximity with others outside of their household for prolonged periods of time or for close contact. I also wanted to clarify that tournaments and other types of competitions involving multiple teams are still not allowed at this time. Next slide, please. So again, I just want to close. I know we'll have time for questions, and that's really great. We want to make sure that we answer the questions that you all have. I wanted to close again with really encouraging people that vaccination is so, so important. And for the athletes and for the youth who are 16 and up, it's really critical that they get vaccinated also. In the coming weeks, as we learn whether and when approval comes for vaccination of 12 to 15-year-olds, as we're anticipating, you'll be hearing more and getting news about that as well. So even that younger age group of children will also have opportunities to be vaccinated in the coming months over the summer. Thank you so much for your time and attention, and I will turn it back over to my colleague, Katie, and we will, I'm so sorry. We now have our colleague, Dana Ketchum from Rec and Park, who's going to give updates, really critical updates for how Rec and Park has been supporting athletes and families over this entire pandemic, and they've been great partners to work with. Thank you so much, Dana.
Thank you, Dr. Phillip. It's been really a pleasure to work with your team as we work to get things open. Good evening, players, volunteers, parents, coaches, administrators, athletic directors. I recognize so many of the names on this list, and I am really so happy to be here tonight talking about how we are able again to let our kids get out and play. We know it has been hard on many of you and families and everyone else. I'm going to go a little bit about what we've done and then where we're going. As many of you know, this spring we instituted a program we called Let the Kids Play as soon as we found out it was possible. The concept was to find a way to provide a shortened spring season for kids in a record amount of time. Normally our season starts March 1 and we start the process 3 months ahead of time, generally in late November and early December. This year we started on March 24th and we had kids out practicing in under a month and games starting shortly thereafter. Just after we launched this, we had been working with the private high schools. We learned that SFUSD was going to offer high school sports this spring in a few sports, and we pivoted to make it all fit and happen. I really want to credit all of the coaches and administrators who came together to work out a plan for getting this done. And I also really want to credit my staff and Jeff and Christine, who many of you work with. We estimate that we had over 15,000 kids getting out there to play on our fields in San Francisco, and we are thrilled about it. And we also, while we did it, we just didn't say, let's push them out. We did things to keep it safe. We put more space between game fields in a number of places. And its simple answer is South Sunset. We skipped a field in between so there was space. We put more time between games so that one set of team could leave, because one of the things that we learned from the health officers that one of the biggest spreads is like the time off the field. So there were time for people to leave before the next set of people came, and space for fans. So where do we go from here? First, I just want you to know that we are committed to reacting as quickly as we can as health orders change. So, you may not have everything you want at this point, but as soon as we get it, we'll move. But we're already working on it. So we're working on summer programming. There are a variety of summer camps out there, and our our summer camp fields have all been basically released in the last week. So lots of opportunities for families to get out and have their kids play. In addition, the Mission Summer Soccer League is registering players and teams right now. And the Junior Giants Baseball League is open for kids to sign up and play. We're also working with groups who want to just practice over the summer and do other sorts of play. So we're very flexible, and we're trying to work with everyone to get kids out and playing this summer, because we know normally a lot of families travel a lot over the summer. You know, this time not so much. So we're trying to make that happen. At the same time that we're doing the summer, yesterday, we launched the beginning of registration for the fall. This includes our usual youth sports leagues that we have in the fall. And we are happy to say that we're working with SFUSD on making sure there's space for middle school sports, which weren't able to happen this past year. And we're all hopeful that the school district will be back in session because the health order will allow it, and we'll get those kids back playing, as well as high school. If you need help on how to form a team or get a field or any other information, and we're going to put this at the end, please email rpdfields@sfgov.org. Many of you know how to reach out to me. We want to make it happen, and we want to get everyone out and playing, because that's what we do. Thank you. I'll turn it back over to Katie.
Thank you so much, Dana. So at this time, I'm going to turn it over to Glynis. We have received some questions when people were registering for this event, as well as some that might have come in through the chat. So Glynis, I'll let you take it away.
Great, thank you so much. First, really quickly, I will address a simple question. Someone asked if we could share the slide deck that we've been using, and we can send it out to everyone who registered for the Zoom link. So you should be able to pull the information there. Next, Dana, we have a couple of questions for you. The first question is, what sports will be available for middle school and high school age children this summer and fall?
Okay, so as I just mentioned, we have baseball going on for girls and boys. We have mission soccer, and we're also open if there are other people that are interested, but we have so many different sports camps going on since kids are out of school. So there's field hockey, there's lacrosse, there's golf, there's tennis, through a variety of different providers. So lots of opportunities, and high school, you know, is harder, but there is soccer programs and baseball programs.
Thank you. And Dana, actually 2 more questions for you. One that just came in that I believe was about the rec summer programs, which is whether all staff are vaccinated. Not sure if you're able to answer that one.
Phil might have a better idea about where we stand on vaccination for our staff.
Yeah, we are not allowed to ask if staff are vaccinated in any government. That's not allowed, but our staff are well aware of vaccination opportunities. And I think it is worth noting that all of our staff have been taking care of kids for the last 16 or 17 months in emergency childcare and community learning hubs, in summer camps last year and in summer camps this year. And we have not had a single outbreak related that was anything other than an occasional community transmission from a parent or child or something outside of the program. So I believe that the vast majority of at least my staff are taking advantages of opportunities to be vaccinated. But that is anecdotal. But I can tell you that our programs have been extremely safe and well run for the last 15, 16 months.
Great, thank you. And Dana, one more question for you right now, which is, will we have tryouts for fall, and will teams playing summer league get practice fields? So I guess 2 more questions.
Okay, so unfortunately we can't do tryouts for fall. We've been talking to teams about that. and programs, because you are required to join a team for 3 weeks, and that one-off moving from team to team to team group trying out doesn't really work. You know, obviously people that are interested have the different programs are reaching out and contacting families. We are going to be posting flyers from them, so people who are interested in them can find out about how to get in touch, how to participate in video conferences. Coaches can go watch them play. So there's a variety of different approaches, but it's not quite the same. And then yes, practice fields. There's 2 different ways to do it. Number 1, sign up for one of the leagues. Number 2, go on our website and fill out an out of school time, we call it an OST, practice pod request, and we'll be happy to work with you on both of those for this time. You know, there is one other thing I do worry, we are focusing on a little bit, is with SFUSD's kids not so much in school, we want to make sure that those kids have a chance to sign up for fall teams, and fall registration always happens in the spring, normally before everyone closes. So we're working to make sure that those families and those recreational teams don't get left out. Thanks.
Wonderful, thank you. And now we have a couple of questions that I think will probably be for Dr. Phillip and Anna. Dr. Phillip, we have a question about whether there are repercussions or plans in place for those who do break the rules. For instance, what are the penalties for teams that travel out of state?
I want to start by thanking the vast majority of athletes and coaches and teams and schools that have continuously, no matter how hard it has been for them personally and collectively, have done the right thing. So I want to start with saying that the vast majority of people that participate in these activities have done it the right way. And I want to thank those people first. We recognize that it is not fair if there are people who are going around the rules. The rules are in place to protect the students and athletes. They're there to protect the staff. They're there to protect all of San Francisco, quite frankly, and to allow us to keep moving forward. So we do have compliance measures in place. We follow up. I write letters to start with, and then we have progressive ways that we move forward, and that can include losing access to some of the facilities that Dana was describing in the city for practices and other things. So we take it very seriously because we do recognize it is not fair to everyone. This is a collective sacrifice that we recognize that people are making. It's very difficult what we are asking you to do, and we do not want people skirting around that and without getting our efforts to bring them back into compliance, however we can do that.
Wonderful, thank you. An additional question for you is, under what circumstances or tier will teams or camps be allowed to run for less than 3 weeks?
I know that this is a really important issue, and it has come up outside of the sports setting as well, just with camps and other summer activities, because it makes it, as we know, quite challenging to have camps in these 3-week intervals. As Anna was describing before, this is intentionally has been the way we have done it in order to try and limit the amount of shifting and changing cohorts that happen over time. This kind of cocoons and keeps each athlete or student with a relatively small number of people and have that not be changing as much. Having said that, we continue to evaluate this, and just as we have changed some of the requirements for operating and doing sports indoors and outdoors as cases have come down, we know that this is an area of high importance, and we'll continue to look at it. We do understand that for this summer, most of the programs have already locked in to that 3-week cycle, and that's what's going to make it really difficult. But we don't anticipate that we will be continuing this. If things go the way that we hope they do, and our cases continue to go down, this will be something that we do not carry out into the future indefinitely.
Thank you. And Anna, we have a couple of questions that are related to specific guidance at this time. With the move to yellow tier, will SFUSD, oh, I'm sorry, this is about SFUSD, so we probably can't answer, but it was whether they'll allow spectators to athletic events. So maybe you can clarify just what our guidance is on that currently.
Our guidance currently allows spectators to be at the athletic events and competitions. And we certainly will work with our partners at the school district to inform them as to what our current guidance and directives allow.
Thank you. And then San Francisco has an added limitation on capacity for indoor youth sports set at 25%. Will that capacity be increased under the yellow tier?
I will answer that. We anticipate that it will increase when we move to yellow tier to 50%, up to 200 people maximum within a building.
Thank you. And Anna, we had a question about what summer guidance will look like for overnight sports camps.
That is an excellent question. Thank you very much. As far as the health department is aware, there is no overnight sports camps or any overnight camps that happen in the city and county of San Francisco. They tend to happen in other counties in California, and it's all parents and caregivers that are enrolling their children in overnight camps should look up the county of residence, the county in which the overnight camp will occur to see what the guidance is there. But we do not have any guidance for overnight camps in San Francisco because as far as we know, there is none.
Thank you. And we had a request for more details on what guidance is for spectators. So what is the difference between indoor and outdoor sports and spectators?
The spectators would follow the guidance for gatherings in indoor or outdoor spaces, and they would also count against the capacity for the building, because it really is about the number of people there and the ventilation, et cetera. So what I would say is that it will match and follow the guidance that we have for indoor and outdoor gatherings.
Thank you. We received a question. I think, Anna, this is probably for you, although please anyone else jump in. Can you talk about playing indoors in gyms or buildings that don't have airflow or windows to open, et cetera? Is that okay?
Can you repeat that question, Glynis?
I believe it's a question about whether you can play indoor sports in locations that have limited ventilation.
Ventilation is a very important prevention measure for all settings related to COVID-19. And we are asking all of our partners that deliver youth sports to follow our ventilation guidelines, which we can put in the chat and we can distribute out with the links to this slides. If there are no windows, we ask people to put in mitigation measures such as portable air cleaners or MERV 13 filters in their HVAC systems, et cetera. And that all of that is outlined in great detail in our ventilation guidance.
Thank you. And we have several more questions on guidance. What recreation sports are allowed indoors for kids during recess?
The word recess implies that this is related to school. So I'm going to assume this is about PE and recess at school. We are allowing all activities at school activities at sport and at recess, as long as the school's guidance is followed within the cohort, and that with the equipment, all of the children are washing their hands or using hand sanitizer before and after using shared equipment, et cetera. But at this point in time, we are allowing all sports at school recess.
Thank you. And a couple of questions that are really about how you can run, I think, sports teams. So are we able to run clubs that are a mixture of middle school and high school?
My confusion lies in the fact that we ask the teams to establish cohorts or set teams that would be stable over time. So as long as the teams are a range of students, but they are as part of a team for at least 3 weeks as part of our guidance and that should be fine. I'm losing a little of the detail related to that.
Anna, I can help a little bit. I think clubs, the way clubs are often structured, it's by birth year. And sometimes those birth years or a team is like the 03s or 04s or 05s. And sometimes those kids straddle 8th grade and 9th grade, for example. So there might be kids that are on the same team from both middle school and 8th grade and 9th grade. And your point is, it's really about the cohort. And if the kids stay together as the cohort, then it's fine.
That's right.
Wonderful, thank you. And a question about who is responsible for overseeing testing I assume where it's required. Is it the school or sports program, or is it the site? And this is from someone who has a gym that they rent to schools.
I'm sorry, Glennis, repeat that, please.
Sorry, so there's a question, I believe this is about sports where testing is required, screening testing, and they're wondering who is responsible for overseeing that. Is it the program or is it the site that is renting to a program runner?
It is the program that is responsible for the testing requirements. So it either can be the actual school, if it's a school affiliated sport, or if it's a club league, they would be responsible for that.
Okay. Thank you. And we have a question that I think it would be helpful to get both Dr. Phillip and Dana or Director Ginsburg to weigh in on. It's, will fall sports return to regular programming, or will there be modifications? And if so, what will they be? So maybe Dr. Phillip, you could address that generally. I believe you're on mute.
Thank you. We generally are aiming to try and get back closer to normal for all types of sports and activities as much as we can. Having said that, we're going to have to do what we've done this entire time, which is look at our data, look at our statistics here locally in San Francisco, and then also be aware of the trends that are happening regionally in the state and across the country. But we are anticipating that we'll get closer and closer to that. So I don't have an exact answer right now because I can't necessarily forecast with 100% certainty. But things are looking good now, and we have the tools in the forms of vaccines to get us to the place that we can get back closer, even to normal in the fall. So I'm hopeful, but I can't be 100% certain and predict at this moment that it would be from my public health officer standpoint.
And Dr. Phillip, if I could make a plug for you, doesn't that question exactly speak to the importance of continuing to play by the rules this summer? Absolutely. So that we can get back to normal in the fall.
Absolutely.
And I do want to add that for outdoor sports, fall looks pretty normal. You can't do tournaments. You can't have guest players, but we're playing our sports, and those sports are largely, you've got to wear masks still, but we're getting really, really close, which is why we're doing registration now and feel confident. You know, obviously things turn sideways, we'll have to retrench, but we're in a good spot.
All right, thank you. So we actually only have one more question, I think, at this point. And this one is for Dr. Phillip. It's, do you know how quickly after FDA grants authorization that 12+ will be offered vaccines in San Francisco?
Thank you. We are actively preparing for this now. We know that for us to be successful and continue to be successful as a city, we have to be ready to partner with everyone from pediatricians, because we know that the trusted providers are really the #1 best place to get your child's vaccines, to helping set up other places across the city. So we're doing that work now in anticipation. Generally, what has happened is that once the federal government, the FDA, gives its approval for use in a certain age group, What has happened is that California, Washington, some of the other Western states have brought their scientific experts together to also look at the data as one additional layer of review. And that happens in a day or so. And then there's yet another organization called the Advisory Committee on Immunization Practices, the ACIP, that works with the CDC. So we usually will wait for that process. It usually takes a few days to maybe a little bit under a week for that to happen once we hear that. But we're planning to be ready to go. And so we want to make sure that if there are questions, if there are concerns that people have, they're able to get those answered either through some of the materials that we'll put out publicly or in talking with your own pediatricians and other providers, because it will be so important for individual children's safety, but also collectively for teams, for schools, for our city, to be able to expand vaccination as soon as folks are eligible. So thank you very much for that question. We're thinking a lot about it, and we're open to trying different ways of increasing people's uptake of those vaccines.
Wonderful, thank you. I believe those are the questions that we received, so I can pass this back over to Katie Tang.
All right, thank you so much, Glynis, and thank you so much to our wonderful speakers, Dr. Phillip, Anna, Phil, and Dana, of course, our Joint Information Center virtual outreach team, and to all of you who have participated tonight. So I just want to direct you back to the chat where Glynis had copied and pasted the website link for our Department of Public Health information on sports and COVID. And so please refer to that for any future updates. And other than that, you know, our webinar tonight was being recorded. And so if you do wish to review it again or share it with any of your colleagues, please do so. So at this time, I'll turn it over to Phil to close us out. And again, thank you all for being here.
Thanks, Katie. Look, it's been a horrible year and a particularly crappy year for our kids. So I actually wanted to end by thanking all of you for being on the call. You're on the call first and foremost because you care about the city's kids, and you know you understand, like I deeply understand, just how important youth sports are to the development of our children. You're also on this call because you want to do it right, and for that we thank you. Perhaps there are people that wouldn't want to spend the time hearing from Dr. Phillip and the rest of us about what you can do and what you can't do. So I thank you for actually wanting to understand what can happen. We're close. We're almost out of this. I had a great experience today where I was at Youngblood Coleman in the Bayview with Bayview United, which is SF Rec and Park's free soccer program. And to see kids back on the field and to see the smile on their faces, to see them play, grow, compete a little bit, was just as inspiring as I can, as I could possibly contemplate. And I know you all know that, which is why you're on the call. So I wanted to say thank you to all of you for choosing a path where you're mentoring or coaching or just caring about our city's kids. And I also really want to acknowledge, and hope you all will acknowledge, the incredible, difficult work that our mayor and our public health officials and specifically the people on this call have done over the past year to keep us all safe and to set us up for a quick a return to normalcy as possible. The rules are difficult. They're confusing at times because this virus is not predictable and hasn't been predictable. And I think we all owe an incredible debt of gratitude to our public health officials and to everyone who is trying to keep us safe and keeping an eye on the health and welfare of our city's children. So I'll stop there. Thanks.
Thank you, Phil. Perhaps our Joint Information Center will close us out officially.
Thank you, Katie, and thank you all for joining the town hall on youth sports this evening. For more information, please contact schools-childcare sites at sfdph.org or RPD fields at sfgov.org. Have a wonderful rest of your night.